Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for a better business and a better health.
And I'm Fred Goldstein with Accountable Health, here helping you work to reopen during the COVID pandemic. So Nick, I know you've got some thoughts around contact tracing, an important issue. What's been going on?
Well, so let's first of all talk about what contact tracing is. And just for clarity, I've done the course. I'm an authorized contact tracer, although I haven't actually formally done it. I did it because I thought it was an appropriate thing to do. So I went through the Johns Hopkins course, which was great, good insights, reaffirmed a lot of things and certainly taught me a few insights. But essentially what you do is you identify somebody that has the disease, and then you want to identify what we term close contacts. And those individuals need to be treated and separated out from society so that we prevent potentially the spread. Because if you imagine somebody that's been identified and has a positive result, then they could have transmitted. We know with reasonable degree of certainty that if you spend a certain amount of time within distance without face coverings, we can classify people as either low or high risk, and we put them into isolation and test them to determine if they have. Now, what that requires is essentially a deep dive into somebody's personal life. And it reminds me a lot of my experience when I was working in the hospital that I trained at. We were a nexus for HIV. At the time, we didn't really know what HIV was. It was a challenging disease, and we had what was called an STD clinic, or sexually transmitted disease clinic, and we had to do contact tracing. And it was one of the most awkward experiences that you could imagine, because you were asking people who their sexual partners were. Well, nobody wants to tell you that unless they're boasting about something. And, you know, most people talking to an absolute stranger, even if they said they were a doctor or a contact tracer, doesn't want to share that information. And we're having the same problem with contact tracing, where people are resisting it for fear of retribution, challenges, all of those things. And I think what it requires is a cultural sensitivity to the local circumstance. So I imagine in other countries, you might have different experiences where people are compliant, want to. The US is much more free-spirited, free-thinking. I don't have to share that information. But the reality is that this is such an important thing. And if you do it with the right context, so it's not pejorative, so there is no punishment. This is like root cause analysis. And you encourage people to share information and do so in a way that is sensitive to cultural issues, to personal issues, and not break confidences, we have an opportunity to shut down problems, because we identify them, we isolate those individuals, determine who's been infected and those that haven't. Those that haven't can return to normal life, and those that have go through the quarantine. The majority of people we're finding, especially in the younger age groups, don't suffer any disease, don't have any symptoms. But the important thing is we end up preventing you from killing somebody or potentially killing somebody. I think that's a pretty good outcome.
Absolutely. And before you finish up with this, can you discuss what is considered a close contact? I know CDC has some standards around that.
Yeah, so it's, you know, have you spent more than 15 minutes within a 6-foot range of an individual, even if you're wearing a face covering? So unfortunately, even if you have a face covering, and, you know, to be clear, that doesn't mean to say that you're going to get the disease. It just means that we consider you slightly differently because you're at higher risk. This is all about a risk profile. That classifies you as a close contact. If you walk past somebody in the corridor and you're both wearing face coverings, that's a low risk interaction. That's not something. And if you don't spend extended period of time, so you walk into a store, you have an interaction for 5 minutes and that individual had the disease, but you were both wearing face coverings, that's not a close contact. There are certainly some additional details, but for all intents and purposes, that's how we work it.
Right. And we are seeing now a lot of thinking about risk relative to distance and space, indoors, outdoors, given the aerosolization of a virus.
Right.
So some of this may change over time, right?
Absolutely. And I think that's what's important about this is people need to understand that it's variable. It requires some human intervention. This is not just an app. Oh, insert an app on your phone and suddenly we can contact trace because, wow, you came into contact. Or the fact that it was through a wall doesn't matter. So, absolutely complex, requires specialist focus and detail. But all of this lends itself to this sort of cultural sensitivity. And I know you've been sort of experiencing this a little bit in a local setting. From a very basic standpoint, tell us a little bit about that, Fred.
Yeah, it's interesting because what you're talking about actually dovetails exactly with what some things I'm seeing, and how do you then try to change behaviors and work with it. So this past week, again, I had the opportunity, the first time ever I've gone out to a restaurant in or since February, outdoors, mask, place was great. They got a sign, you quickly went through, and then they gave us a great table outside. And the individual who began to set our table and everything, paper menus, by the way, which was great, and was wearing a mask, but it had a valve. And clearly that's one of the things the CDC is recommending against now, because it just exhales the stuff out and doesn't really do what you're trying to do, which is protect others. So that was the first instance. And I was trying to ponder with myself, what do I do? Should I nicely talk to him? Should I ignore it? Should I leave? And I just decided at that point to ignore it. I'm still working on how to appropriately, as you say, culturally seek to intervene and keep people recognizing it's not a pejorative. You're not really going to hammer people for it. I then went to the Publix this week and noticed that they pulled all of the directional signage off their floor. And the week before, I had been in a situation where an individual had been clearly walking the opposite direction. And I quietly said to him, you might want to look at the floor signs. And he proceeded to tell me in not uncertain terms to take a hike. Very
I
loud.
mean, not unpleasant terms, if I recall.
Yeah, it was rather a little
Abrupt.
bit blunt and actually a little fearful after that. And so I just kind of decided, no more there. And then I went to a pet supermarket and noticed that there were 4 people in that store with no masks, although there clearly was a mask sign, and employees had the mask below their nose and things, and we're talking to someone else, one had it completely off. So the question becomes, again, with this behavior change, how do we help people? How do we not hammer them? What level of enforcement is appropriate? And I think the CDC has recently recommended do not tell people to stick a mask on if you're working in a retail setting or a store or something like that, because of some of these negative outcomes. And it gets back to what you talked about, Nick. We've got to come up with some new ways to keep people from becoming complacent, from actively going against things, and help them understand and keep doing the behaviors we're trying to do, or change as new behaviors come into play. And I'm not sure we've quite figured that balance out yet. And it may be, as you said, regional. Maybe certain parts of the country, the Northeast apparently is doing better. Us in the South, we're struggling a bit. And we should look at some of those things, I think.
Yeah, I think the key in the approach is to be as positive, supportive, not pejorative. I've had some experiences, certainly with some valves. I tried to approach it from a very passive way. And what ultimately turned out to be the case was the individual was trying to do the right thing, had purchased these thinking they were great. And it turns out there was a complete opposite, and was really upset to learn that, but was happy to learn it. So I think it's possible. I think the overriding ask I have is, please be nice.
Yeah.
Both on the receiving, but also on the giving end. We all need support in this, and that's my purpose and intent. And I know most other people, that's theirs too.
Absolutely. And I know, Nick, in our work with some of the universities, that some of the universities have posted some really good and nice and effective responses, beginning with, thank you so much for wearing that mask. Just, did you realize X or Y, or you have a beautiful nose, but I think your eyes are better. Something like that, that makes it a little more lighthearted, but, tries to help without really being negative. But it can be tough to do sometimes in situations when you suddenly see something and jerk up. So thanks so much for the time again, Nick. Fantastic discussion on contact tracing. This is Fred Goldstein with Accountable Health.
And this is Dr. Nick. I'm the incrementalist here with incremental insights for a better business and a better health.